Well, the big smile on my face, of course, is on such a beautiful day as I look out here into the crowd. I see mostly friends and some people who I don't know. So for those of you who are friends and felt an obligation to come, thank you for coming. And for those of you who are not friends, I hope to become friends, and I really express my appreciation. I think what Darren said and mentioned about the human ecology is never really thought about it in that regard. But at a time, actually, when Mount Desert Island Hospital is now cutting back on their treatment of outpatient addiction services, and at a time when the island unto itself is having problems treating the disease of addiction, and that we now are relying almost exclusively, from my understanding, on the Acadia Family Center, I am going to inflict a little bit of guilt right off. You should buy books today galore. You should give them off as Christmas gifts, even if you've read it and you don't like it. Because I'm not going to make a penny on this, but Acadia Family Center will benefit. And I think it's something that we all, whether we're summer residents or tweeners like my wife Allie and I are, we're here between seasons as well as summer, or you're full-time, it's something that's really important. The book Addiction on Trial, Tragedy in Downeast, Maine could be Addiction on Trial, Tragedy, New York City. Addiction on Trial, Northeast Kingdom, Vermont. Addiction on Trial, anywhere USA. The reason I picked the title Addiction on Trial, Tragedy in Downeast, Maine is because I know when it becomes a Hollywood hit movie that they'll want to film it in a beautiful spot, and what more beautiful than Downeast, Maine, as you can see, which is a picture of Somes Sound. Why I wrote the book? Well, first, why did I get into addiction medicine? I got board certified in emergency medicine initially, and I morphed my practice into addiction medicine. And I did both for a while. And the reason I did is because when you go into emergency rooms in certain areas of this country, and now more and more so, sometimes up to 50% or more of patients who are there because of the disease of addiction, whether directly or indirectly. Whether it be the kid with asthma whose father smokes cigarettes, or the unwanted teenage pregnancy because a woman and a man were intoxicated, or the rapid heartbeat from amphetamines or cocaine, or the person who's pretending by sticking a needle in their finger and putting a drop of blood in their urine to try and get opiates. So between the fact of taking care of kids with bugs in their ears and the gunshot wounds, and God only knows how much trauma is related to people who are intoxicated on cocaine or on alcohol, it became clear that the disease of addiction has a phenomenal impact on our society. So I wrote the book, one, because I wanted to, and two, because I thought that, first, you write what you know, and also I thought it would be good to try and educate while entertaining. Now, I was totally entertained by writing this book and creating the characters, but most importantly, I felt that it was important for me to convey these characters in an omniscient manner. So although some of my editors said, well, it's just not in vogue to write a book from an omniscient viewpoint, i.e., when Jimmy's talking, I can not only tell you what Jimmy's saying, but I also can get into Jimmy's mind. And when Adam, the father, comes to visit Jimmy, the person from away who's convicted, who is accused of murder, that you can understand what it's like to be the father. And when you're the police chief in the town that's struggling with this disease of addiction in the town of West Haven Harbor, which we all know sits here on Mount Desert Island, and the book takes place in 2004 before they put the Causeway Bridge in, so you needed to take a boat across to the mainland. I'm sure you all remember that in 2004. But having said that, so in order to touch and feel each of the characters, I needed to get into their minds to relay to the reader who they were and what they were feeling. So the story takes place, as I said, in Mount Desert Island, where Jimmy used to visit his Boston Brahmin grandparents from years ago and met a young boy by the name of Travis. They were both young boys. And Travis's mother and Jimmy's grandmother used to meet in the West Haven Harbor Library and read books to the kids, and this is where they met. So someone from here and someone from away, and the kids met. Jimmy grew up pretty much with a silver spoon in his mouth, and Travis grew up as the son of a lobsterman. So right now we have the mixture of cultures, and it really sets the stage for me to talk about this disease as being an equal opportunity disease that knows no socioeconomic barriers, in contrast. So I'm going to start off right off the bat with a little audience participation. How many of you do not know a heroin addict? Raise your hands. Who do not know a heroin addict? Well, quite a few people say they do not know a heroin addict, and I'll bet you that the majority of you people who raise your hands are wrong. You know a heroin addict. I'll bet you, be willing to bet almost everybody in this room knows a heroin addict. You may not know who that heroin addict is. Could be your electrician. And I should have said an opiate addict, because that would include OxyContin and the others. It could be your doctor. It could be your IRS agent, who I've treated. It could be a college professor, of which I've treated many. And it could be the downtrodden person in the slums of the inner city. So we have to start understanding that there's no good addiction and bad addiction. Alcohol addiction is not a good addiction, and heroin addiction is a bad addiction. So Adam gets a call from his son, who's in jail in Downeast, Maine. Jimmy, after years of sobriety from heroin and having lived with his father, who unfortunately had to raise Jimmy as an only parent because his wife, darling wife Suzanne, died at the age when Jimmy was only 3 years old, gets a call from the emergency room in Kansas City to fly, and immediately gets on a plane the next day to visit Jimmy in jail. And Jimmy again has migrated back to Downeast, Maine in order to start life anew. He was not using drugs when he arrived. Adam was led into a sterile, white, windowless room approximately 10 feet square. Jimmy was in the far corner of the room behind a cold metal table. Seated on a low wooden stool, he had the appearance of a small boy who could barely see above the grown-up's table. Jimmy's head was bowed as he nervously picked at an excoriated lesion on his left palm, having removed the bandage that the nurses had previously placed over it. He scratched back and forth with raggedly bitten nails of his middle and ring fingers of his right hand, digging progressively deeper into the layers of tissue until fresh blood mixed with dry scabs from prior scrapings oozed out and trickled on his blue jeans. This was a vile habit that paralleled his drug use. It did not matter whether he was high from drugs, in withdrawal from waning drug effects, or just dreading the discovery of his drug use. He would pick at the thick muscle below the thumb where it merged into the hollow of his palm, burrowing until it bled, as if this self-mutilating behavior would heighten his awareness of the painful path of drugs he had once again chosen. When he was clean from drugs, the bleeding stopped. So I understand that in order to write a novel and to get people to read it, and to educate people through the back door, because who wants to read another book about addiction? That you have to write a novel that doesn't just talk about drugs. It has to have drugs, sex, and rock and roll. So I hope to have time to touch on all of these aspects of this book, but for the moment I want to focus just on the part about drugs. Because when Jimmy left Kansas City to start anew in West Haven Harbor, he had his last therapy session with a wonderful psychotherapist, Saul Tolson. And Saul sat with Jimmy to discuss what it would be like to leave his father's home and to try and stay clean as he had been for the last 36 months or so, after nearly dying several times. And Saul Tolson is a gentleman in his mid-60s, and he gave up his practice of suburban psychotherapy in order to become a drug counselor at New Beginnings. And he's seasoned, articulate, and insightful. He's a gentleman in his early 60s. He preferred the word patient to client because he felt that this was a disease and this was not a practice of suburban psychotherapy. And because this was the therapeutic arm of the treatment of a chronic disease, and Jimmy was a patient. So he gave lectures on a regular basis, and he would talk to the PTA, he'd speak to the police department, he would speak to physicians at hospitals, he would speak to almost anybody who would listen. But he always started his talk in the same way. He would talk about how when he was at Harvard years before, the Harvard crew coach would never take all the people for the crew team as his first choice to crew, even though the crew team won many awards and participated even at the Olympic level. He would always want athletes who did not know how to crew because he always thought it was easier to teach somebody the right way than to unindoctrinate somebody from the wrong way. So Saul in his lecture states, "Well, I do not have the luxury of the Harvard crew coach. Everyone in this room already has an opinion of what an addict is. Usually we use the word addict in a special way. Cocaine addict, heroin addict. But rarely do we hear the words alcohol addict or nicotine addict. No one would refer to Vice President Cheney as an addict, despite the fact that we know nicotine contributes to heart disease. And Mickey Mantle remains the hero despite needing a transplant, a liver transplant, for his chronic alcoholism. I am hopeful that each of you can put aside any bias that you bring to this room today, any preconceived notions. For 30 minutes, I ask that you be like that athlete who has never rowed before and put aside your current opinion of addiction. Give me your cleansed mind for just a brief time. At the end of my presentation, you may accept, reject, or modify anything I say. But please start now with a clean slate. Before I begin, I want everyone to join me and tightly close your eyes. For just 60 seconds, let us each listen to our own breathing and contemplate nothing. Not everyone followed Dr. Tolson's request, some dumping him into the category of those earthy, crunchy granola-type liberals, precisely the type of labeling he was trying to combat, which is why he would wear a sports coat and tie to the lectures. He would wait a full 60 seconds before saying, "Now slowly open your eyes," and without verbally responding, I want you each to ask yourself if the last 60 seconds was spent only listening to your breathing while repressing all thoughts. If you were not successful in completely voiding your mind, you know what the struggles of addiction are like. It is not just mind over matter. I will do my best to further explain the complexities of addiction. Dr. Tolson had a sincere and disarming manner to his presentation, part professor, part psychotherapist, part scientist, but always human. He discussed in painstaking details the disease of addiction in a respectful manner while laying out the cornerstones of the disease as a biopsychosocial illness of lifetime duration. He described it as a disease of incurable nature, possible to be put into remission, similar to some cancers. He elucidated the Scandinavian alcohol studies of identical twins being adopted by different families to illustrate the genetic predisposition as well as Skinner-like conditioning as contributing factors. He explained how veterans who had become heroin addicted during the Vietnam War could more easily overcome their drug abuse when returning stateside as representative of the social aspect of the disease. That the elimination of social cues was such a powerful determinant of remission. But the next eye-opening part of this lecture was a presentation of slides showing the reward center of the brain. Saul loaned me his slides for this lecture, so it's very nice of him to do that. I now wish to briefly bring your attention to the next slide. Here is the nucleus accumbens, the ventral tegmental area, and the prefrontal cortex. They all are integrated in the activation of the brain's reward pathway. Saul Tolson knew all this scientific mumbo-jumbo lulled much of the audience to sleep, but he needed everyone to be alert for the next comment. He purposely lowered the octaves and raised the volume of his voice while adding brief pauses to summon attention as he continued. Now, for those of you who have dozed off, and I do understand why, this next slide is a must-see. It clearly demonstrates there is very little disparity between the different chemical addictions. This slide demarcates the areas of the brain affected by drugs and clearly illustrates that alcohol, nicotine, heroin, and cocaine all create the effects through the same common pathway, which originates directly or indirectly at the level of the nucleus accumbens. In fact, the same medication called naltrexone is used to curb the craving effects of both alcohol and heroin. Dr. Tolson concluded his medical presentation with a sobering analogy. Diabetes is a chronic illness. It is a disease that can be controlled, but as of yet cannot be cured. It has a genetic component, but is exacerbated by poor diet, lack of exercise, and lack of attention to medical management. Think about a person with uncontrolled diabetes, or for that matter, a smoker with heart disease who eats a bag of potato chips on Super Bowl Sunday and goes into congestive heart failure again. Both of these patients now need emergency care that doctors immediately render. Many of these patients return again and again. And for many, it's for reasons at least partially due to their non-compliance with treatment. Nevertheless, they are readily evaluated and treated for both their acute and ongoing illnesses, even though their own behaviors are contributing or causative factors to the deteriorating health. Pausing while attempting to make eye contact with each and every individual in the audience before proceeding, Dr. Tolson delivered his next few lines in a compassionate tone. With no disrespect, but as a way to reinforce the point I'm trying to make, I'd like to ask you to please tell me the difference between a nicotine and an alcohol addict, who in some cases may even receive a heart or liver transplant, and someone addicted to heroin or cocaine. Why are those afflicted with the disease of addiction to certain drugs treated so differently than patients who suffer from nicotine or alcohol or other chronic diseases like diabetes? Are they really any different? Dr. Tolson never relinquished the podium without one last attempt to convert the naysayers. Now, for those of you who fail to agree with me, and I know you're out there, let me appeal to your wallets. To incarcerate one addicted patient, that's right, jailing patients, costs between $40,000 and $50,000 per year. Understanding this book was written in 2004, so these are 2004 numbers. A one-year stay for a patient in a halfway house costs about $20,000 per year, and this does not include any medical care. But to treat one heroin addict, and he goes on to explain everything included in this treatment, which is outpatient counseling and medication management and urine drug testing, et cetera, costs approximately $5,000 per year. And if I may add, in Maine, and these again now were 2004 numbers. But the reason I added this number here to Saul Tolson's slides, the 3,000, is because the state of Maine has now cut their funding over the last several years from $5,000 a year, which is what it was in 2004 and has not gone up, down to $3,000 a year. So it's no matter what, obviously there's a reason why Mount Desert Island Hospital, for example, is one example, can't afford to treat these patients. And how much does it cost, and what is the risk to society when patients are denied access to care and get sick with HIV or spread the disease? So what's the total economic cost of drug abuse to society? You better be sitting down, because according to a 10-year study by the Executive Office of the President for National Drug Control Policy, the financial price tag to society related to crime, health care, and lost worker productivity is $182 billion. Yes, you heard me correctly. Is not an ounce of prevention worth a pound of cure? As a Midas commercial says, you can pay now or you can pay later, but you're going to pay. Thank you for all your attention. I'm able to stay for questions. Uncomfortable with the inevitable applause. Thank you very much. Dr. Tolson kept repeating through the clapping. So there must be some questions. The questions came, but none of his answers carried the consequences of those he would have to give to questions posed while under oath at the murder trial of James Frederick Sedgwick in Downeast, Maine. Da-na-na-na. Da-na-na-na. So early on in the book, I try and lay the groundwork of what the drug of addiction is, and then move quickly into the hook is, did Jimmy kill Annette? And Jimmy's blood and Annette's blood is splattered all over the dashboard and steering wheel of Annette's car. Cocaine in Jimmy's pocket matches the bags of cocaine on Annette's table. Annette's found at the bottom of the ravine. It's a horrific sight. And, well, I mean, certainly, and Travis is out at sea scalloping at the time, so it certainly couldn't have been a domestic quarrel. He's off in George's Banks. And so, did Jimmy kill Annette? So, you know, for those of you who have read the book, please don't say anything. And I know some of you haven't. For those of you who haven't, I really would appreciate if you did read the book, because I really am stuck writing the sequel until I know if Jimmy really did do it. So I'd appreciate it. But so this, let me see here. So I know that I talked about the equal aspect that it's an equal opportunity disease. And, you know, we hear about the Boston firefighter in 2013 who was selling drugs, and we hear about the aide to the Boston mayor, Mayor Menino, who was implicated for possession and distribution of drugs. And we know about the New Hampshire elementary school principal at one of the finest elementary schools in New Hampshire who possessed and was distributing drugs as part of a drug ring in 1999. And we all know about Philip Seymour Hoffman and River Phoenix and John Belushi and Janis Joplin. We all know those people. But how many of you can give me one name of the 80 Mainers who died in 2012 from drug overdoses? Just give me one name. And does anyone remember in 2004, Bethany Fritz was a Maine high school student who tried heroin, and she died. And she wanted to become an art major at the University of Maine. But we don't really think about those people. And then there's Travis Boehmer, the fisherman. So I promised you a little rock and roll, and I'm going to read you a little bit about Travis Boehmer. Because everybody on that list, everything there is real. Travis is real in my mind, but he represents what I'm talking about. Travis was out at sea scalloping when Annette's body was found at the bottom of the ditch. Didn't know about Annette's death, his fiancée. In order for him to survive out at sea as a heroin addict, he couldn't be snorting or shooting heroin. And heroin's so pure now you don't need to shoot it, you can snort it. So he had to find a way to keep himself out of physical withdrawal symptoms. So he would bring his Oxycontins, his 20 milligram pinks and his 40 milligram yellows and his 80 milligram greens. And every morning he would surreptitiously take whatever Oxy he thought just to get through the next 6 or 8 hours. And then dinner time he would do it again in order to keep himself out of withdrawal. So here is Travis, a heroin addict, out at sea working, making a living. Of course, he would have liked to have gone for treatment for opiate dependency, and would have been nice if on Mount Desert Island, where he lived in West Haven Harbor, if they had a treatment center, like they had a diabetes center or hypertension, but there wasn't one, and he had to get on the ferry and get to the mainland, and then it's another 45-minute drive or an hour drive to Bangor, and he didn't have time to do that and work. So it was hard for him to get treatment. So here's your rock and roll. The Margaret II, which is the boat he's on, lurched forward and took the next wave bow first. Unfortunately, they hit an unsuspected storm while out on George's Banks, which normally would be a better position than broadside to take rough seas, but this was not the case with unsecured lines, a swinging guillotine, and the crew being tossed around if they were pinballs in a game machine at the arcade. The weighty dragger and scallop-filled net abruptly changed course and swung violently over the stern as the bow pointed up toward the crest of the oncoming wave. The combination of these forces pushed the boat stern suddenly and severely deeper into the trough, pulling it into the sea. Rick, who was struggling to get up, lost his balance and went careening head first and face down across the slippery deck. As he desperately attempted to slow his movement, clawing with hands and flailing his legs from side to side in hopes of finding some object to latch onto, or at the very least to upgrade his awkward position, the water pouring over the stern pushed against Rick's face, filling his mouth with salty brine mixed with the fishy remnants left on deck. As Rick was about to be swept over the stern into the sea, Travis the heroin addict, clipped a long line around his waist, secured the other end of the line to a cleat, and proceeded to crawl across the deck while holding on to the rope with one hand to take up any slack. With a desperate reach of his free hand, Travis barely snagged the suspenders of Rick's yellow slicker fishing pants and held on for dear life. As the Margaret II reached the peak of the wave, Travis stood up while pulling Rick to safety. In an instant, the dragger's rakes with the giant bundle of scallops swung diagonally across the stern and clubbed Travis in his left chest, knocking him squarely onto his back. With pain searing through his body, Travis struggled to right himself while the boat sat briefly in the trough between swells. With enormous energy, the dragger retraced its path to again swing unimpeded out over the stern, recreating the same scenario as just moments before. As the bow climbed, the entire stern abruptly filled again with sea, and in a split second, Travis was in excruciating pain. Became a projectile sliding feet first on his back, flipping over the stern transom and disappearing into the 56-degree ocean. So let's take a break from the rock and roll and take a break from the book readings, and let's get back to something that deals with Travis's illness. So when we talk about the disease of addiction, and again, I want to give full credit to Saul Tolson for making and giving me his slides, we need to start thinking about the disease of addiction in many forms. And I'm going to move through these slides quickly, and the benefit of not having a tremendously large room of people is that I will be happy to answer lots of questions later, and I could even get together with any of you at book readings or any book clubs and to talk more and more about the disease of addiction if you'd like. So I'm going to move through this quickly, and there's no way I can give a 3-hour medical lecture in 15 minutes or less. But let's talk about the history of opiates. Back in the American Civil War, morphine was a painkiller, became a national health hazard. And in 1874, diacetyl morphine was first synthesized. What is diacetyl morphine? Oh, excuse me. Diacetyl morphine is heroin. And the Bayer Pharmaceutical Company of Germany marketed it as heroin in 1898. In the early 1900s, the average opiate abuser in the United States was a middle-aged, middle-class mother, typically addicted to a combination of opiates that they refer to as laudanum. But where did the love of opiates come? Well, it didn't start in 2014, it didn't start in 2004, and it didn't start at the Vietnam War. Let's go back to 1680, where the father of English medicine, Thomas Sydenham, said, "Among the remedies which it has pleased Almighty God to give to man to relieve his suffering, none is so universally and so efficacious as opium." Sort of sounds a little bit today about how marijuana cures everything. And in fact, if we go to the next slide, back in between 130 and 210 AD, Claudius Galen, the Greek physician, writer, and philosopher, and please, women, do not throw your shoes at me when we get to the end of this reading. Opiates, they resist poison and venomous bites, cures chronic headaches, vertigo, deafness, epilepsy, apoplexy, dimness of sight, loss of voice, asthma, coughs of all kinds, spitting of blood, tightness of breath, colic, the lilac poison, jaundice, hardness of the spleen, urinary complaints, fever, dropsies, leprosies, the trouble to which all women are subject, melancholy, and all pestilences. Well, this is great. So I was just wondering if I could get a little of this stuff because, I could play tennis 5-6 hours at a time. I wouldn't have any problems. So let's talk a little bit about what tolerance, dependency, and addiction are because there's misconception. Tolerance is when I like to refer to it simply as less bang for the buck, meaning that if I have 3 scotches every night or shoot up 3 bags of heroin every night, after a while, those 3 scotches, the 3 bags of heroin don't quite do it. So I need to shoot a little more, drink a little more to get an effect. So I've built up my tolerance to the drug. Dependency now is symptoms and absence of the drug. So I've built up my tolerance so much that my body's dependent upon it, and I stop drinking abruptly, and I shake, I get the DTs. If I'm a heroin, whoops. Well, there goes my pointer. Thanks. There's always something interesting at a talk, isn't there? And so dependency, when you're an alcoholic, for example, you'll shake. When you don't have your drug, thank you very much, Joanne. When you're an opiate addict, you'll feel like you have the worst flu ever. Nausea, vomiting, goosebumps, chills, abdominal cramping that'll just send you into the fetal position. But there's a difference between dependency and addiction. Aunt Tilly goes into the hospital and gets treated for cancer, and she's in intractable pain, and we put her on a morphine drip or we give her another opiate in order to take away her pain. And after 3 weeks of this, and maybe surgery, and the tumor is no longer pressing on the nerve endings, she now doesn't need as much morphine, or maybe she doesn't need any. But she's dependent. We've made her dependent on the drug. But what separates her from being addicted is the fact that when we wean her off that morphine or other opiates, she's not out there drug seeking. And the other hallmark of somebody who has a disease of addiction is they have drug-seeking behavior despite the potential harm to themselves or to others. So we talk about addiction as a disease model, as a biopsychosocial illness, self-inflicted with genetic predisposition, self-medication of underlying disease. We do a horrible job in this country treating mental health. And because of that, people look for other alternatives. If you're depressed, cocaine works for a short period of time. And if you're anxious, we all know those people doing 3 shots of tequila before they get on the airplane because they have anxiety. And a lot of bipolar people find that heroin sort of evens them out a little bit until they all become addicted to it or dependent on it. We know that this is an illness, it's a family dysfunction, and we know that there are secondary complicating illnesses, both medical and psychiatric, whether it be HIV or hepatitis C. And 50% of all substance abusers, and that's a term which we no longer like to use, we like to call it the disease. People have a disorder of substance use rather than their abuse. Put it in a more positive framework of a disease. But those people who we refer to, or society refers to as addicts, 50% of them have an underlying psychiatric disorder. But drug addiction is a brain disease that, albeit chronic, can be treated. No different than the person with liver disease who can get medications to help them excrete some of their toxic metabolic substances. Because their liver has been damaged. And as well, a brain can be damaged by alcohol, we know, and lungs can be damaged by nicotine. But the important thing is that even if you don't want to believe that this is not mind over matter, that is when you start to use a drug, it has been shown through PET scans and other evaluations and examinations that, in fact, the brain changes both anatomically, structurally, and chemically with advanced addiction to heroin. So it can be treated, though, and some of the treatments from a medical point of view are methadone and buprenorphine, and we'll get into that. And the discussion of methadone and maybe even buprenorphine, I know, is a heated topic in all parts of society, and it's like, I don't want a methadone treatment in my backyard, and that's a topic that we'll talk about briefly. So who or what to blame for the opiate epidemic? Well, first of all, let's blame the physicians. I see another physician out here. We should just blame the physicians. Because if it wasn't for them prescribing the Oxycontins of the world, we would never have all these people who move from Oxycontin to heroin, et cetera, and get addicted. But then again, I remember when I was in medical school, I saw people in China having their gallbladders taken out under acupuncture. So all those people in this room, all you Americans who want to have their gallbladder taken out under acupuncture, please raise your hand. No, raise your hands. Huh, interesting. So really, we're a society that really deals in the immediate. We want a cure today, doctor. One of the reasons I couldn't go into pediatrics is I love the kids, I couldn't stand the parents. And the reason I couldn't stand the parents is even though 75–80% of all ear infections are viral, is the parent would come in and demand an antibiotic and wouldn't leave my office until I gave him an antibiotic. So I gave him an antibiotic, knowing that it wasn't the correct thing to do because people are demanding it. So I could fight with each and every parent about this. We as a society have a responsibility as well as the physicians. So those are the patient expectations. How about the internet? I can go on the internet to, anybody have an iPhone? Maybe we should order up some oxys and maybe get me some Viagra while you're at it. I mean, so the internet plays a role as well. And it's interesting. Let's blame the pharmaceutical companies. I mean, we got to blame the pharmaceutical companies. How can we let them off the hook? Because they make the OxyContin. Well, when I had my rotator cuff surgery for the first 72 hours, it was really nice having the OxyContins. But when I was done with it, even though the doctor gave me more than I needed, I got rid of the rest of them. And in fact, I didn't abuse them. But we want to blame the pharmaceutical companies because you could take the OxyContins when they were first formulated and you could crush them up and you could liquefy them, or you could snort them or liquefy them and shoot it up. So we made the pharmaceutical companies reconstitute the OxyContins and make it so you couldn't snort it and couldn't shoot it. So what happened to heroin addiction and heroin abuse? It went skyrocketing. OxyContin abuse went down and heroin abuse went up. So is it really the pharmaceutical companies, or is it the fact that people have the disease of addiction? And if you take away the OxyContins, they're going to migrate to another opiate. The war in Afghanistan. Well, I know we're not nation builders, but in my personal opinion, we might be nation destroyers. And when we went into Afghanistan, there was subsidization by the Taliban for the farmers not to grow opium anymore, and they grew food crops. When we ran the Taliban out of town, what happened is the farmers no longer had the subsidization, so they went back to growing opium. They flooded the European market. All the South American heroin, which was going to the United States and Canada and to Europe, got diverted just to North America because Afghanistan had flooded the European market. So supply and demand, what do you think happened to the price? It went down. So, and the worldwide amount of heroin went up. NIMBY, not in my backyard. We can blame ourselves. How many people in this room would love to have a heroin treatment center in downtown Bar Harbor, or in West Haven Harbor, or Southwest Harbor? Well, how about Seal Harbor? Again, I don't see many odds. Right. How about in Trenton? How about in Ellsworth? And the closest one is Bar Harbor. Bangor, excuse me, is Bangor. And so the point I'm trying to make is that this community, tragedy in Downeast Maine, is no different than tragedy in Boston, tragedy in the Northeast Kingdom of Vermont, tragedy in Southern California. I don't care where you're from. Is people do not want treatment centers in their neighborhoods, so not in my backyard. Supply and demand, war on drugs. The war on drugs has universally failed. I don't care how many drug lords you put in jail and kill. There's too much money in it. It's big business. So someone will fill the void. We need to do a better job with physician training and their biases. We talked about mental health and the public officials. Shame on our public officials. Our departments of public health, our elected politicians. I wrote an op-ed, actually, in the Boston Globe, and I basically said, the summary was, is if our politicians and our public health officials step forward, and for every time there was a Viagra or Cialis commercial, we had a commercial destigmatizing and demystifying the disease of addiction, and it just became something that we understood it was a disease and we needed to treat it, then people would become educated and less likely to oppose treatment centers in their community. And the attitude that, well, if I open up a treatment center, all the addicts are going to come into my community. They're already here. Oh, did I go the wrong way? What's going on here? There we go. So Governor Shumlin of Vermont is my hero. He spent his entire State of the State address talking about the disease of addiction in the Northeast Kingdom. What a brave, courageous man risking his entire political career. So let's talk about illicit drug use. And I'm going to go through these slides very, very quickly because I haven't gotten to the sex and there's a little more rock and roll. And I know that you don't want to leave without some of that. But on a more serious note here, look at these statistics were in Massachusetts. I'm sure other states have them. Didn't see that Maine had done this study. But the most use of current illicit drug use by income level are those people making between $35,000 and $50,000 per year. But those making $75,000 plus per year equal those making less than $25,000. And from an educational point of view, the slide speaks for itself. We've already talked about the cost of treatment, but this is a really interesting study. There were 6 treatment centers, in 1991, we knew this. There were 6 methadone treatment centers in the Baltimore, Washington area. And they measured the number of crime days their patients had before entering treatment and the number of crime days they had per year, total per year, while in treatment. So, for example, in Clinic A, there were 264 crime days before they were in treatment and 27 after. So as Saul Tolson said, let me appeal to you all, even if you don't feel we should treat these people. So now those of you who have heard this talk or heard me speak before, I have here a free ebook card. Methadone treatment works, and that's a whole other topic. But who was the president who put methadone treatment on the map? Yell it out. First one to get it wins this free ebook. Nixon. Who said that? Unbelievable. Pass this back to this bright woman in the back, please. Richard Nixon. His war on crime. You're the first person who ever has gotten that first time. Usually it's Reagan, it's Clinton, it's Jimmy Carter. When Nixon did his study on the war on crime, he found that it's only 99 cents. I don't want you to think the e-book's on sale on Amazon for 99 cents. Normally it's only $3.99, but it's just, but please do get it. But now that you won the free e-book, you have to buy a book to contribute to the Acadia Family Center. No, I'm kidding. So this should tell us something. Back in Nixon day, we knew this, and this is a study from '91. Here's another study from '91. Oh, well, actually, I'm going the wrong way again, which dealt with. But this is the third study in 1991 by Ball and Ross, and this showed that, and this was taken out of the original article, which is why it's a slide that's of curious condition. But when a person is detoxed prematurely, premature termination of methadone maintenance treatment, within 10 to 12 months, 82% of those people are back using heroin again. So premature detoxification of people off of methadone doesn't work. If it's a chronic illness, how many people say, well, I'm sorry, you've got diabetes, we'll give you insulin for 10 to 12 months, and then after that, live free or die, right? I mean, it just doesn't work. And unfortunately, the Governor LePage in Maine, for example, has tried to put restrictions on the length of treatment for patients. Yes?
What's the stat for if you go full treatment? What's the recidivism?
So recidivism rate if you complete methadone detox. Well, there are some people who literally never get off replacement medication. Methadone does not make you high if you've built up a tolerance and a dependency. If you try to withdraw people and they continually go into withdrawal, it's sort of like trying to lower the insulin and seeing if the glucose doesn't rise. And so the real question, maybe if I could answer, is what's the percent of success? Is that what you're asking? What's the success rate? Well, the success rate is 100% if you're talking about getting people off of heroin by either keeping them on methadone or slowly detoxifying them from the point of view of going back to using quickly. But there's obviously, that number isn't going to hold up because there are obviously those people who have life issues and other issues that drive them back to using drugs again, like Jimmy, who was clean for 36 months. So if you have a person with the addiction to alcohol and they're clean for 36 months and then they start drinking again for 6 months and then you treat them, whether you treat them with antabuse or naltrexone or other medications, or they go to AA, or for whatever reason they get sober again. And then they're sober for another 3 years after, quote, falling off the wagon for 6 months. Is that a success? Something society needs to decide, right? But we don't cure it. And I understand what you're asking. So as far as at what level do you get 100%? Maybe I misspoke earlier by saying 100%. You get 100% success if you're allowed to treat those patients who need to be treated with methadone on an ongoing basis. And I'm going to move quickly. Portland is a direct entry point for the heroin. Heroin is 90% pure. You don't have to shoot it up. We've talked about most of the other aspects. But look at this. This is June. This is June's newspaper here in Maine. And look at this. I love this. Free. I don't know what's free, the heroin or the newspaper. And this is July 4th. Happy July 4th. Doctors, police brace for influx of laced heroin. Portland used to have 2 to 3 emergency calls a week for drug overdoses. They now have 3 to 4 a day. What's the cost of that? Pick your state. And if you have an orange state, drug-induced deaths in that state now exceed motor vehicle accident deaths. Is there anybody who can claim residence in a non-orange state? Raise your hand. Huh. Maine addiction treatment issues. There's an increase among young women in Maine using heroin and getting addicted. The governor cut back on Medicaid funding, and 400 people patients who are in treatment for heroin addiction are no longer in treatment because insurance no longer covers it, and they're now on the streets in Maine. And I know that because of the 2 clinics I'm medical director, one in Portland and one in Lewiston. 140 some odd patients had to leave treatment. And as I said, Mount Desert Island Hospital now is giving up their outpatient treatment model. But if you're pregnant or you live with a child, you can get Maine Care for treatment. So if I'm an addict and I'm a woman and I get pregnant, I can get treated again. Maybe I should just get pregnant, even though I'm addicted. So it really doesn't make sense what we're doing. And I talked about the governor wanting to impose some limitations of opiate treatment. And look at this, because of the number of parents with substance abuse problems, look at the number of children now in foster care going up. So this is one way to deal with it. We can be direct and abusive and confrontational because we have a different political viewpoint. But I personally don't think that's the way to go. And in fact, I wrote an op-ed in the Bangor Daily News, and this was basically when Governor LePage said naloxone, i.e. Narcan, which is a life-saving medication. So if somebody overdoses and you get that medication, the patient will start breathing again. You have time to get them to the hospital. He did not feel family members or law enforcement officials should carry that drug. So I wrote an op-ed basically equating it to the person who lives with somebody who's a nicotine addict and has emphysema, and when they have an acute asthma-like attack, the wife says, "Oh, honey, I'd love to give you some oxygen, but if I do, it'll just encourage you to smoke again. So I hope you make it. But if you don't, I can't give you oxygen because that's going to go." Well, that was Governor LePage's approach to the issue of naloxone, that it would encourage people to use more heroin. Well, come on. We haven't been giving naloxone to these people for years, and there's a heroin epidemic going on. In Maine, 7% of babies born are addicted to opiates. By the way, that was not a picture I picked. That was a picture that the Bangor Daily News decided to put with my article. So we just talked about the Narcan bill. Governor LePage, it did pass unanimously. Governor LePage did not veto it, although he didn't have veto. He couldn't. The House and Senate could override the veto, so it was of no value, but he refused to sign it, which is unfortunate. So he stayed silent. But he did veto in 2013 a Good Samaritan law. And that law would allow people to call and say, I have somebody here, I think they might die from a heroin overdose. And when the police then arrived, there would be immunity to the caller. So it would encourage you to call. He would not sign that bill. He vetoed, as a matter of fact. So people on methadone maintenance in Maine, 95% reduction in illicit substance use, 80% reduction in patients with arrests, 64% decrease in the rate of homelessness, 39% reduction in psychiatric admissions, and a 13% increase in employment. So in summary, for every dollar invested in alcohol and drug prevention saves $5.60, and for every dollar invested in alcohol and drug treatment saves $7. So it's now 6 o'clock, although I did start 8 minutes after. And I'm hoping that I have just a little time left for a little sex and a little courtroom rock and roll. So that I don't want to leave you all with the understanding that, in fact, this book is just this really heavy book, which it isn't. The focus on the medical aspect that I just went through in this PowerPoint slide is not fully emphasized. You heard Saul Tolson's page and a half. That's about all you get as a reader, trying to educate through the back door. But Sean Marks, because this is a Sean Marks thriller, one of many to come, Sean Marks is that egotistical but likable attorney from Boston who comes to Downeast Maine, who along with Rob Hanston and Jimmy's father Adam forms the defense team to try and defend Jimmy from a crime that we don't know, nor do the lawyers when they're defending him. Over the ensuing months, Hanston, that's Rob Hanston, the Bangor attorney, the Columbo-like, disheveled, brilliant Bangor attorney, and this slick Italian suit lawyer from Boston form an incredible team. Sean Marks lives on a 40-foot Hinckley at West Haven Harbor, and the reason he came to Maine was not altruistic and not financial. He did not want to have to deal with the court case in Manhattan in the middle of summer. He much preferred to be in Downeast, Maine. So that's what brought Sean Marks to Downeast, Maine. So you can love him and you can hate him, or you can do both. But over the ensuing months, Attorney Hanston worked diligently to put all the pieces together. Marks would make his physical presence felt in West Haven Harbor every weekend, arriving by plane on Friday evenings, except the one Friday in early July he had set aside to romance Samantha Kotz. He was not fully prepared to be discombobulated when he left Miss Kotz's apartment in the Back Bay of Boston early on Saturday morning, first driving 25 minutes to Swampscott to grab some legal papers, remembering as he was searching his home desperately that they were still on his desk in Boston, and then having to beeline back to his office to fetch the documents before bolting to the airport. Excuse me for 1 second. This chapter must be making me, excited here, so I needed a little swig of water. I beg your pardon? That's just water. Miss Kotz had interrupted more than his routine, as their sexual chemistry had interfered with his ability to stay focused. Marks had not considered a first date sleepover as an available option, and therefore was not prepared for the morning race to the airport. He had felt a paralysis as he looked at Samantha Kotz. He had enjoyed lingering in bed next to Samantha, still asleep, lying on her side facing him, soft auburn hair draped gently over her forehead, and sheet clinging to her mid-back, exposing her youthful velvet skin. It was very difficult leaving Samantha Kotz behind, as he dreamt about spending a morning in bed with this spunky lawyer, especially after a night like the one from which he was recovering. Marks was at peace with his frustration of having to leave. He knew he had laid more groundwork than ever anticipated. After a peck on her cheek and with coffee in hand, he headed down the steps to the cobblestone sidewalk and into his waiting Porsche. The parking ticket under the passenger windshield wiper served as a reminder that everything good in life comes with a price. He had never wanted to pay the price of a day-to-day monogamous relationship, despite the positive benefits. But what Marx felt that morning as he looked at Samantha made him uncomfortable. Marx is in his mid to late 40s. But what Marx had felt that morning as he looked at Samantha made him uncomfortable. The $60 parking ticket was a small price to pay compared to the emotional price of a committed relationship. Marx avoided being distracted by his feelings, as he wanted to focus on the euphoria of the moment. He seamlessly slipped back into denial as he regressed to a prior stage, putting the convertible roof down to celebrate a great evening with the rest of the world. Sean Marx was 30 again. Just a quick little rock and roll, and I'll be done. Do we have time for just one little rock and roll? The trial begins. Da-na-na-na. As the trial neared, the defense and prosecution completed the routine steps of their legal dance ensemble, with opposing lawyers each attempting to take the lead. Legal documents traveled back and forth as fast as the internet could transmit them, as discovery, disclosures, reports, and pretrial meetings with Judge Von Dalen consumed both the defense and the prosecution. Each maneuvered for the slightest advantage, while the judge's role was to maintain a level legal playing field. He demanded a fair trial without shenanigans. The judge's approach of a paternal legal scholar settled jurors while setting limits for lawyers. With slightly coarse salt and pepper hair, cut neatly but worn longer than most judges, an engaging face with blue eyes, tortoiseshell round bifocals, an upright posture accentuating his solid dimensions, and a brilliant mind, Christopher Von Dalen had all the necessary ingredients to rule a court of law from his perch above. Van Lehuizenen, the Finnish district attorney. Huizenen presented her closing argument with the same panache as when she had practiced in front of her bedroom mirror. The long juror's rail allowed her to gain an added rhythm to her presentation as she glided back and forth with long fingers caressing and tapping the round wooden rail in concert with the cadence of her accented voice. She had masterfully adapted her presentation to nullify the smoke screen of defense witnesses with carefully chosen words so as not to upset Judge Van Dalen. So why does someone choose to murder? This question is debated over and over again by criminologists and psychologists, but there are many theories. You do not need to understand all the aspects of this esoteric debate. You do not need, what you need to evaluate is if the overwhelming amount of evidence presented is sufficient to convict the defendant, James Frederick Sedgwick, a known drug addict, for the murder of Miss Fiorno and not be swayed by conjecture. You must determine if the numerous incriminating facts confirm that Mr. Sedgwick murdered Miss Fiorno, or maybe she was still alive but injured when he tossed her down the ravine to die a slow death. There is sufficient evidence to point to motive. Whether Miss Fiorno was murdered to cover up her knowledge of Mr. Sedgwick's addiction, or maybe she knew that Mr. Sedgwick was a drug pusher, or maybe it all went bad when he tried to seduce her through the use of cocaine, which one could assume was cocaine he purchased and brought to Miss Fiorno's home, or any variety of possibilities. The fact remains that there is an abundance of evidence to support multiple motives. But short of the accused answering the question of why he decided to murder Annette Fiorno, we may never know the exact motive. Regardless, there must have been some planning of his actions, as illustrated by the methodical nature of the events that transpired that fateful evening. I will leave this courthouse today knowing that over the past several weeks, the truth and the whole truth has been uncovered. I trust you will not make your decision lightly, but I also trust that as honest and insightful folks from Downeast Maine, you will make the right decision, and in doing so will provide not only some solace for Annette Fiorno's family, her fiancé, and friends, but even more importantly, you will demonstrate that justice has been served. James Sedgwick can be the only person responsible for Annette's death. It was premeditated murder by a drug addict from away. Thank you, thank you. I must only say, though, that I do want you to buy many books and to spread the word to others to buy the books, to go to Sherman's, to go online. I always want people to support the local bookstores, and there's an old joke that says, the way in which you can have a small fortune is to start with a large fortune and then open up a bookstore. So we need to support our local bookstores, and so I hope you do that. But you can spread the word for people who are not here on the island, or there isn't a bookstore that carries the book, to buy it on Amazon. And whether you buy the book on Amazon or buy it from the bookstores, of which COA was kind enough to cooperate with, in cooperation with Sherman's, to sell the books here if you're so interested. I would appreciate if you all went onto Amazon and gave me a review, because only through the reviews does the word get out. But although the world is full of suffering, it's full also of the overcoming it, by Helen Keller. And the final comment I will have before turning the podium over to Darren and the gang is that I truly am passionate about this topic, and I truly do enjoy interacting with people in book clubs. And I am more than happy, and if you go to my website and you go to book club and author events, you can email me right through the website, and I will Skype in, or I will do it in person to come to book clubs and discuss the book. So I really want to thank you all, and I know some of you have read the book. I know that most of you in the room, all of you in the room I know, have been very supportive of me, so thank you very, very much.